I'm Dr. Evan Parks, and I'm the author of the book, Chronic Pain Rehabilitation, Active Pain Management that helps you get back to the life that you love. In this episode, we're going to be talking about how to use the calm breathing exercise and get that plugged into the physical exercise that we do on a regular basis. And what I'm talking about is exercise that you might be doing that helps your cardiovascular endurance, like walking, jogging, cycling, or using an elliptical. While you're doing these exercises, you can also be doing the calm breathing exercise. So just a little bit of review. The calm breathing exercise goes like this. You breathe in slowly through the nose, a little bit extended exhale, and then you pause and you hold an empty breath. So a slow breath in, slower breath out, and then you hold an empty breath. So as we shift to physical exercise, there's going to be one key difference. We're going to do all the breathing through the nose. So the breath in and the breath out are going to be through the nose. And then we're going to be tweaking this holding the empty breath part. And that's going to be helpful. So to get us started, what I'm going to do is explain just a little bit about what happens when we are breathing. What's the mechanics of this? So as we breathe, we take in oxygen, and our lungs use that oxygen and gets it into the cells. So in our cells, the cells have fuel, and that oxygen has important use in utilizing that fuel that's there. And when that fuel is broken down, and it's called metabolism, the byproduct of that breakdown process, or releasing that energy, is CO2, or carbon dioxide. And when we breathe out, we are breathing out this byproduct, carbon dioxide. So you might think that carbon dioxide is just this byproduct of this gas that we don't use or don't need, but it's actually not the case. And so there's another part of this breathing exercise that relates to what I just explained. You see, our blood has in it red blood cells. The red blood cells have within it hemoglobin. Hemoglobin carries oxygen, and it releases it where it needs to go when it gets to its destination. The hemoglobin needs CO2, carbon dioxide, in order to release that oxygen out of the hemoglobin. So if our CO2 levels are too low while we're exercising, the body's not going to be able to utilize the oxygen that it's there. Most people have a really high saturation of oxygen in their blood at all time. If you use a pulse oximeter, which measures the amount of oxygen in your blood, you can typically find between 95 and 99% saturation of oxygen in your blood. It's not that we lack oxygen, that we're getting out of breath and that we're tired and we're fatigued and we don't have energy. It's really this CO2 problem, this carbon dioxide problem. And we can increase the amount of CO2 in our bloodstream by how? By taking in less air, and we're going to be doing that by breathing in through the nose. And we can also do that by holding an empty breath. And so you can test your empty breath limits like this. It's called the BOLT test, Body Oxygen Level Test. And this tests the capacity of your body to utilize the oxygen that it has. It's very simple. So the first thing that you're going to do is you're going to take a watch, a stopwatch, a timer of some kind, and have that handy. You're going to breathe in through your nose and then out through your nose. And as you exhale, you're going to hold an empty breath for a certain length of time until you feel this urge to breathe. Not until you're going, gasping to breath, but until you just feel a gentle urge to breathe. You're going to feel it a little bit in your throat or in your chest, maybe in your stomach, maybe some contraction of the muscles. that's the sign that it's time to breathe in. And you should just kind of breathe in normally in a relaxed way, not gulping for air. That's holding it too long. And so you're going to measure the length of time, and it might be 15 seconds or 10 seconds or maybe 20 seconds, something in that range. And what you're going to do then is regularly practice that while you're doing this breathing exercise that we've talked about in a previous episode, the calming breath exercise. As you breathe in, breathe out, and hold about every 10th breath, you should try to do this extended hold and time it. Over the course of days and weeks, you're going to find that you're going to lengthen the amount of time that you can hold that empty breath. By doing that, you're actually increasing the amount of CO2 that's in your blood that allows for this exchange of oxygen to take place. And that will help you be much more efficient in the use of the oxygen that you actually have, increasing your energy level and your stamina and improving your overall cardiovascular endurance when you're engaged in physical exercise. So to take this out with you when you're walking, what you do is you do the same breathing pattern that we've talked about, 4 in, 6 out, a little bit of a hold. You do that 3-4 minutes, and then on the 3rd or 4th minute, what you do is you try to extend that hold. And as you try to extend that hold, you keep walking and you time it. How long do you walk? Or you count your steps. How far do you go? And you do that every 3 or 4 minutes on your walk. And what you're going to see over time is you gradually extend the length of time that you can do this hold comfortably without any distress, without gasping for air. And by doing that, you're also going to be increasing, again, the amount of CO2 that is available for this exchange to take place. So the neat thing about that is you're going to quickly see that it increases your endurance. It increases your stamina. You're going to feel that you can go further and faster than you have gone before. This is very, very useful, especially when you are already struggling with movement because of chronic pain. It helps calm down the nervous system, this breathing pattern, especially when you're out walking. So to sum up, what you want to do is practice the breathing, get a Bolt score for yourself while you're sitting comfortably. Regularly practice that breathing so you can extend the length of time that you can do this hold, and then apply it to walking so that you can go out and do a walk, and then 3 or 4 minutes into it, do this breathing and with a hold, and then recover, and then 3 minutes later, do it again. And you are going to see some neat benefits that come from it. I do this breathing pattern, nasal breathing, while I run. And what I really was surprised with is how hard it was to begin doing this, and then how relaxing it became once I was able to do it, and how far I could go running in a completely relaxed state, only breathing through my nose, taking in less oxygen than I normally would. So experiment, let your own experience teach you. To learn more about this, you can listen to the podcast version of this video, Pain Rehab Podcast. You can also go to my website, painrehabsource.com. Contact me with your questions. I look forward to hearing from you and look forward to talking with you again. Take care.